So thank you for inviting me to give this, talk. So today I'll be talking about a lot of practical strategies that can improve your sleep while you're experiencing chronic pain. And this is based on cognitive behavioral therapy for insomnia, which is, the first line and gold standard treatment for insomnia. So we'll be talking about more on the practical side of things. But just to give you a bigger picture, when it comes to sleep disorders, there are many types of sleep disorders that can impact your overall sleep health. I will be primarily focusing on chronic insomnia, which is defined by, taking more than half an hour to fall asleep, fall back asleep, or if it occurs more than half the time a week for at least 3 months. It is a distressing concern and in some ways negatively impact your functioning during the day. And it's not because you didn't give yourself opportunity to sleep. It's you have given yourself opportunity to sleep, but you just can't. So that's what I mean by chronic insomnia. So first, I like to just start off some really common reactions when you're awake. So oftentimes people report feeling frustrated and annoyed, or you might worry about the consequences of not sleeping well. This might be health concerns or how you're functioning the next day. You somehow wonder if you're broken, if your sleep system is wrong, and that you'll never be able to sleep again. So oftentimes people might resort in using sleep aids, or you try so much harder to sleep. You listen to these sleep stories, sleep meditations in the effort to see if you can fall asleep. So being awake at night becomes a very distressing experience. If you feel that this is a familiar description to you, you're not alone. Chronic insomnia is the most common sleep disorders, and unfortunately, far too often when people have chronic pain. So for us to, help improve this, concern, we want to understand, well, how insomnia develops in the first place. So the 3P model is a very classic, conceptual framework for us to understand, how insomnia is developed over time. So here you'll see a dashed line where it's the threshold for insomnia. So at baseline, you have this pink bar, which represent predisposing factors. And essentially, these are baseline risk factors that might increase your risk of having insomnia. So this could be becoming older, or being a female, or if you have a family history of insomnia, you might be genetically predisposed to having sleep concerns. Or if you have a history of trauma, or if you're doing shift work, there are many things that can predispose someone to have insomnia. And next, you'll see here acute insomnia. And this typically refers to the first few nights up to the first 3 months of not sleeping well. And they are often caused by what we call precipitating factors. So these are things that come before or trigger this period of acute insomnia, and oftentimes the precipitating factors are stress, and stress doesn't always have to be a negative thing. Positive things could be stressful. So if you become a parent, or if you got a job promotion, these are all wonderful things, but they do come with change and stress. So essentially, any kind of changes in your life circumstances, or your health or physical health, or physical or mental health, all of those things can trigger acute insomnia. And oftentimes what happens is once you get used to it, or you cope well with it, or the stressors have calmed down, sleep might stabilize and return back to normal. However, in some cases, you can see that, the stressors are gone, and yet you're still having chronic insomnia. So you might wonder, I started having sleep problems when my kid is born, but now my kid is 8 years old. Why do I still have sleep problems? And this comes down to the yellow bar here, what we call perpetuating factors. So these are things that are like habits around sleep or beliefs around sleep that was developed in the early stages of insomnia, that has now continued on, and now chronic insomnia is maintained through these perpetuating factors. And so some of these include, a tendency to, gosh, I didn't sleep well, I want to sleep in, or it takes me a really long time to fall asleep. So I'm going to try to go to bed early to make sure I give myself enough time. So you might end up spending a little bit too much time in bed, and ending up having a lot of variability in terms of your sleep-wake cycle. You might ending up, deciding that I didn't sleep well last night. I'm going to take naps to compensate for it. You might also noticing that you start tossing and turning in bed a lot more, where you might worry or ruminate more in bed. And so over time, when we engage in these habits and belief system, it can continue to perpetuate our insomnia concerns. And so in some ways, what we want to do is trying to address these perpetuating factors so we can eventually improve our sleep. And the question is, well, what is the role of chronic pain? And if we look back at this graph here, chronic pain could be all three of these. So if you have chronic pain, it may increase the risk of having sleep issues. Or it may be the case that the chronic pain itself is the very reason why you start having sleep issues. And as chronic pain takes a toll on you, you might also end up changing your lifestyle that ends up being perpetuating factors. So here is an example of that. So we know that oftentimes we can get stuck in the vicious cycle of pain, both from a physical and psychological standpoint. So on the right side here, you'll notice that, sometimes when you have pain, you might want to start avoiding activities because you don't want to experience pain. And then you might experience some physical deconditioning where you might, experience more pain. And so you reduce activities further. There might be more physical deconditioning where you're now at an increase in terms of pain levels. And similarly on the psychological piece, when you're experiencing pain, it's not fun at all. And in fact, it's very distressing. And so mood becomes lower. And that might manifest into clinical depression. And when that happens, there might be also increased perception of pain. So you're being caught up in this vicious cycle of pain. And so as all of these things occur, you spend more time in bed. You might nap or rest a lot more during the day. You might decrease in physical activities. Your schedule might be a little bit more irregular. And if you're going out less, you might have less light exposure. And we'll talk about the importance of light. And ultimately, there might also be more negative mood where you might worry more about the impact of poor sleep. You might think, oh my gosh, I'm going to, increase my pain level if I don't sleep well. So you end up trying harder for sleep. And all of these are also perpetuating factors that unfortunately can perpetuate the chronic insomnia. And so it probably doesn't come as a surprise that there is a significant comorbidity between sleep and pain concern. So pain can disrupt sleep, and yet also poor sleep might bidirectionally also increase perception of pain as well. In addition to that, mood, and I include mood, but I broadly mean depression, anxiety might be also more prevalent. That is underlying the comorbidity between pain and sleep as well. And so in some ways, if we want to, disrupt this vicious cycle, we want to approach it from all different angles. So that might mean, working with your pain management team that includes your pain physician, your pain psychologist, your physical therapist to really work on a biopsychosocial model approach to pain management. And then it might also be addressing mood concerns, maybe finding a psychiatrist or working with a therapist or counselor, or engage in the community or whatever thing can improve your mood. And similarly, in the case of sleep, sometimes I hear my patients with chronic pain feel very helpless. They feel like, unless I treat the pain, I can't improve my sleep. But you can improve your sleep, even if you have chronic pain concerns. So I will be focusing on how we can improve sleep in that regard. But before I talk about the specifics, I do think there is value in understanding a little bit more on how sleep works. Because once you know how sleep works, it might be a little bit easier to implement some of the related recommendations. So here I present the two-process model of sleep. These are two primary processes that will regulate our sleep. So the first process here is called sleep drive, represented by this upper line here. And sleep drive, essentially, you can think about this as your appetite for sleep. So the higher your sleep drive, the higher likelihood you will fall asleep and stay asleep. And once you fall asleep, your sleep drive goes down. And then once you're awake for long periods of time, you build up sleep drive. And again, once you sleep, your sleep drive goes down. And then we have our circadian rhythm. That's represented by this bottom line here. And this circadian rhythm is very much governed by light. So if it's bright outside, the circadian alerting signals become stronger. And then once it gets darker, your circadian alerting signals go down. And then once the sun comes up again, your circadian alerting signals go up. And then your circadian alerting signals go down as the night go on. And here you'll see these shaded areas. And so what you'll notice here is that you will tend to fall asleep when there is a biggest gap between these two lines. So that means when your sleep drive is relatively high and when your circadian alerting signals are relatively low. When it's at the biggest gap here, that's when you tend to fall asleep. And you tend to wake up when there's minimal gaps here. So how does that relate to what we want to do? So one obvious solution then is, well, let's try to increase our sleep drive. And so how can we do that? So because we know the longer you're awake, the higher the sleep drive. So one thing to be mindful of is your napping and dozing. So if you nap too long or too late, too close to bedtime, you might find yourself having a harder time falling asleep or staying asleep. So this is like if you eat a lot of chocolate bar before your main course of meal, you might not be hungry for your actual meal. So very similar. So ideally, when people have insomnia, I generally discourage people from taking naps or at least limited dozing. But it could be appropriate if you're napping 30 minutes or less and at least 7 to 9 hours before bedtime. So you have enough time to build up that sleep drive. Another one is, well, be awake longer. So what do I mean by that? Sounds kind of obvious, but it can feel a little bit counterintuitive the more we think about it. So let's say that this graph here, you'll see this black bar with that has sleep in it, that's sleep. And you'll see a gray bar here, and that's like you're awake, trying to sleep. So this is often a classic example of chronic insomnia. It takes you a while to fall asleep. Then you finally fall asleep, you woke up again for long periods of time, you finally fall back asleep, and then you're awake again. So you might feel like sleep can feel more fragmented. And so you end up spending a lot of time in bed, but you're not necessarily getting more sleep. And so one thing that we often do at our sleep clinic is try to compress people's sleep schedule so we can consolidate your sleep into larger chunks. And that can improve your sleep efficiency and your quality of sleep. So this is what I mean. So you can compress your sleep schedule by either delaying the bedtime or advancing the rise time, or you do one or you do both a little bit. You end up, compressing your total time in bed. And rest assured, your sleep drive will increase. And so once your sleep improves, then we might, expand it back up. So it fits with your overall sleep need. It might, there's a lot of self-management CBTI resources that will walk you through how exactly would you determine the compression of your sleep schedule. But you can also work with a CBTI specialist who can work with you on fine-tuning the sleep schedule more. But if anything, what I really want to highlight here is more time in bed really is not the solution for more sleep. You've tried that and that hasn't worked. And so it's actually spending a little bit less time, or at least just enough time in bed, that can actually help you sleep better in the long term. But overall, in addition to being awake longer, what's also known to increase sleep drive is spending energy. Like, the more energy you expend, the higher adenosine and the higher your sleep drive. And so part of that might mean increasing physical activities. And oftentimes, if you engage in physical activities in the afternoon, it has been shown to improve the quality of your sleep. But often a common complaint from my patients with chronic pain is, I have this pain and it's really limiting my physical activities. And so one concept that I want to encourage is this term called time-based activity pacing. And so let me just provide a little bit of context of what I mean. So oftentimes when people have chronic insomnia, you could fall into two potential extremes. So one is overdoing things. It might be you finally feel better, so you try to do as much as you can. So then you overexert yourself and you crash. So you find yourself needing to spend a couple of hours, even a couple of days, just to recover from doing that particular activity. And on the other extreme end, you might underdo things where you're very concerned about pain, and so you end up avoiding things, so you don't actually engage in any activities. And so when you're oscillating in these two extremes, it actually limits your activity levels over time and increases your likelihood of pain. So one thing to consider is pacing your activities by including resting period intermittently. And what that means is essentially you want to do an activity and then you rest for a little bit. You do an activity and then you rest for a little bit. You do an activity and you rest for a little bit. But I think the crucial piece is finding, well, how long will I engage in this particular activity? When we think about pacing, oftentimes we stop an activity based on whether we completed a task. So if we completed a task, we stop. Or it might be pain-based. Like if I experience a lot of pain, I stop and then I start resting. But the idea here with time-based activity pacing is let's stop based on time. And so what that means is you actually want to stop after a given time before your pain levels go up. So let me provide an example. Let's say you're trying to walk more and you've noticed that by walking 10 minutes straight, you start experiencing pain. So instead of walking 10 minutes or more, let's just do 80% of that. So let's say 8 minutes. Let me walk 8 minutes and let me stop and rest. Then I'll walk for another 8 minutes and I'll rest and I'll walk for another 8 minutes. So you want to, actually give your body a break before the pain level goes up. And sometimes what I hear from my patient is that, well, that's such a waste of time. I'm spending a lot more time doing the same thing that I can get done in 20 minutes. But think about the possibility of saving time for those crashes where you end up, not being able to do as much because the pain is flaring up. Pain psychologists are extremely skilled at this skill. So I would encourage you to talk to your pain psychologist about this more. But I at least want to insert it here to say that, there are ways that we can improve our physical activities in the context of chronic pain, which will not only help with your pain, your mood, but definitely with your sleep as well. Something that I didn't put on this slide here is caffeine. Caffeine will also actually reduce your sleep drive. So being mindful of your caffeine intake is another consideration. But moving along, since we talked about the two-process model of insomnia, what you also want to then, leverage is strengthening our circadian rhythms. And so the first thing I want to say is you want to sleep at the right timing. And so what do I mean by that? So if you see on this right graph here, here I have sleep to be 2 a.m. to 10 a.m. And here I just want to say that there are a lot of individual differences in terms of when people get their best sleep. Some people are morning birds, some people are night owls. And actually, a common sleep window that I hear from my night owls is actually 2 to 10. There's nothing wrong with that, but you can imagine that if someone needs to go to work, go to school, go to appointments at 8 a.m., it can be a struggle. And so what oftentimes happens with night owls is, okay, if I have to wake up earlier, let me try to go to bed earlier. So they try to go to bed at 11, let's say. But here you'll notice that you haven't reached that widest gap here. So naturally, you will actually have a harder time falling asleep. And so one thing to keep in mind is, everyone sleeps at a different timing. We do want to know what that timing, where our natural window is. And when you sleep in that window, you're more likely to sleep well. It's oftentimes not a straightforward answer into understanding what your chronotype is. Or am I a morning person, evening person? You might have a sense, but you can also talk with your sleep specialist to kind of better understand, what should I do in terms of my sleep schedule? But as I said earlier, the circadian rhythm is incredibly sensitive to light exposure. When it's bright, the circadian alerting signals are strong. And when it's dark, your circadian alerting signals go down. So how this translates and what you want to do is you want a lot of light exposure during the day and especially in the morning. I cannot stress enough how important that is, and especially, ideally outdoor light. Daylight exposure. And then on the flip side, it's trying to reduce your screen use, especially with phone and computer. They do have a lot of blue light compared to TV, that they're also a lot closer to your eyes. So you're getting a lot more blue light that way. So if you can reduce your screen use, you're helping your circadian alerting signals become lower and priming your brain to know that, oh, it's about time for me to be sleeping. Now, for some people, TV watching it's hard to let go. It's just part of ingrained in our habit. And I would say TV, it's a little better than phone and computer. But if you really want to mitigate the risk of having a little bit of screen use at night, you want to make sure you're having tons and tons of light exposure. So remember, what we're striving for is that contrast between night and day. And finally, one thing we want to know is that our circadian clock, our body clock, they thrive on consistency. So it is incredibly important to maintain consistency in your sleep-wake schedule. And the most important one to keep it the same is your rise time. And so this is the case. So you want to get up at the same time, whether you had a great night of sleep or a poor night of sleep, you want to anchor that rise time as best as you can. You don't want to set up a unrealistic, rise time. Like if you're a night owl and you're saying, I'm going to wake up every day at 8 a.m. That might be a little bit more difficult. If you're a night owl and you're trying to move your body clock earlier, there are circadian optimization strategies to advance your body clock, but that's a separate talk. You'll, want to talk to your sleep specialist about it. Unless you're doing shift work where it's harder to maintain that consistency, I would say establishing a consistent rise time is recommended for everyone. So we talked about the two-process model of sleep. And let's say that your sleep drive is relatively high and your circadian alerting signals are relatively low, you're ready to sleep. Then the fire alarm goes off. Naturally you'll be awake. And that's because your fight, flight, or freeze, or what we call the sympathetic nervous system, is activated. And that will, understandably prevent us from falling asleep. And this is a very evolutionary adaptive response for human survival, because if there's a tiger in your cave, like you don't want to be asleep. You want to be able to respond to it. Unfortunately, far too often, the things that we worry about makes our brain think that it is life-threatening, so we need to be awake. So stress management will be important when it comes to sleep. But it's not just sleep. If we think about the correlation between pain, mood, and sleep, stress impacts all of these. When you're stressed out, your experience of pain is amplified versus when you're relaxed. And when you're stressed out, mood tends to be more unstable. And so if you work on stress management, it will help in all of these and will help eventually get out of this vicious cycle here. So from a perspective of sleep, this is what we want to think about. So we want to have a buffer time. And so one thing to remember is we don't really have a switch. Like we can't just say on, and switch, we're off. Like you need a dimming the light period, so to speak. So we need that buffer between your wake day till sleep time. And so that means having maybe a wind down routine, an hour before bedtime, where you're doing pleasant, non-stimulating, non-screen related activities. The next one is really stop clock watching at night. So many people tell me they check at the time, oh my gosh, it's 3 a.m. again. And everyone's math becomes really good at that time because you start calculating how much sleep you've got, how much time you have left before you need to get up. So that is actually pretty anxiety provoking. So I recommend, having your clock turned away, put your phone far away so you don't have access to time. And there's a lot of also other counter-arousal techniques that, I won't be able to go over, but listing a couple of examples here. That might be diaphragmatic breathing, that might be progressive muscle relaxation, mindfulness meditations, or guided visualization or imageries. All of these can potentially reduce arousal levels that might interfere with sleep at night. But one thing I want to say is you don't want to think that this is going to cure your sleep or somehow make you fall asleep instantly, because the reality is nothing really can guarantee you sleep. If anything, it's just kind of lowering the arousal level, lowering the stress level. So there's a possibility to unfold. There's a lot of apps out there. There's the Calm app, Headspace, many, many others. There's one I know that less people know about. It's called COVID Coach. It's made by the VA, so it's free, and I love free stuff. It's a pretty interesting app that has a list of, the different tools for stress management. It's actually made in response to people's stress around the pandemic. So it's something to look into. I know some of my patients have enjoyed it. But when it comes to stress, we also want to remember that if you're awake in bed and you're stressed out about not sleeping in bed, over time, your bed can be associated with that state. And so when that happens, you might notice yourself like you're in the living room, you're watching TV, you're feeling like, oh, I'm sleepy. I'm definitely ready to sleep. And then when you get into bed, you're wide awake. That's what we call conditioned arousal. Like your body and your brain is associating with your bed with sleep. So you're conditioned to be awake. And so what we want to do then is to reassociate bed with sleep in a state of calmness. And so one thing is, trying to use your bed for sleep and sex only. One thing that I didn't write here, but I should include is go to bed when you're sleepy. Don't go to bed just because it's time. Go to bed when you're, closer to sleepiness. Limit the time lingering in bed in the morning. And one of the harder things is to, getting out of bed, especially if you're stressed or worried. And when you do get up, though, you want to engage in doing things that are mildly interesting, mildly boring without screens, so we can promote a little bit of sleepiness. Sometimes I hear my patients say, well, I'm not going to sleep anyway. Might as well doing something productive. So they might file their taxes or start doing house chores or prepare for food the next day. You don't necessarily want to do, you don't want to do that because it's actually going to train your brain into thinking, oh, wow, you want to be awake at 2 a.m. So, okay, I'll try to wake up again at that time. So how you want to think about this is if there's a given period of time with your sleep window, this is your sleep and rest period. So if you're sleeping, you're sleeping. If you're not, at least you're resting. And then, I'm not asking people to, get out and do this thing for a long time. It's just, just do it, and then you can go back to bed after a 15, 30 minute or when you're sleepy, or at least when you're calm. Sometimes the challenge with chronic pain is, there are, real concerns about, transferring in and out of bed, or there might be increased risk of falling. There are modifications around this where at least if you don't get out of bed, you're utilizing different body positions and location of the bed to distinguish a state between sleep and wake. So that might mean, if you're sleeping, you're lying down under the covers. And if you're awake, you're sitting up on top of the covers on the right side of the bed instead of left side. So there's different variations of, instructions of this, but, something to consider. But ultimately, the goal is we want to associate bed with sleep. And so we can condition our body to know that this is a sleepy place. Now, when it comes to stress, we also want to recognize the role of our thoughts. These are common reactions when people don't sleep well. You might think about, oh, I'm going to have a terrible day tomorrow. I'm not going to function, or I have this important presentation. How am I going to get through that? And you might think my pain is going to be so much worse if I don't sleep well. You're really feeling like you're broken, like something is wrong with me, or just this frustration that I should not be awake, like I need to be asleep like right now. And all of these, if you ever have these thoughts, you are not alone. It's a very common reaction. What we want to be mindful of is this mind-body connection, where our thoughts are very interconnected with our feelings, our behaviors, and our physiology. So as an example, if you're telling yourself that you're going to have a bad day tomorrow, like I just know I'm not going to have a good day, you might be more anxious or more frustrated. And when that happens, your sympathetic nervous system might get activated, and hence there might be a lower likelihood to fall asleep. And I think the work around our thoughts and sleep, sometimes it's hard to address it, and I don't expect that after this talk, like woohoo, like all of us thinking are going to be different. But I would invite you to consider the impact of these thoughts on your sleep, and in an effort to maybe practicing a little bit unhooking these thoughts, I invite you to consider some of these questions. So, first of all, is this thought 100% true and based on objective facts? So in the case of, if I don't sleep well, I'm not going to function, are there times that you didn't sleep well, but had an okay day? Maybe not perfect, but relatively okay. Or have you been able to go to work in spite of not sleeping well? Or have there been times that you had to catch a plane where you didn't sleep well, but you were able to enjoy your vacation? It could be a lot of different ways of questioning, but it really goes down to this idea that, are we sure that what our brain is telling us is 100% accurate? And I would invite you to consider that. But also ask yourself, like, if you're really 100% believe that that's true, like, is this helpful? Like how would this thought serve me if I buy into this? And you might realize, oh, okay, I am more stressed out when I think about it. So maybe that's not very helpful. And yet sometimes it's really hard to imagine what it means to let go of that thought. And so I would also invite you to think about, if, let's say in an alternate universe, there's another you who didn't buy into this thought. What might happen? How might you feel like? And how might that impact your sleep? I don't know. I would encourage you to think about this. But also finally, what is something kind and compassionate I can say to myself if I'm telling myself I'm broken or I'm ruining my health by not sleeping? Like if my friend or my child or someone I care about is telling me that they can't sleep and they think they're broken and not, like what would I say to them? Sometimes we're a lot kinder to other people than to ourselves. So I would invite you to consider the impact of our thoughts on our sleep as well. So in some ways, what I like to encourage all of us to think about is, how can we choose a different kind of wakefulness? I think the reality is, we cannot force sleep to happen. The harder we try to sleep in that moment, sometimes the more awake we become. And so in some ways, to sleep is to practice some willingness to be awake. And what I mean by willingness is, I don't mean that you have to love being awake, or you have given up on trying to get better sleep. What it really means is just, you recognize this moment as it is, that you're awake. You recognize that you're not a fan of it. There's nothing more, nothing less to it. The fact is, you are awake right now. And a question to ask yourself is, well, since I'm awake right now, what can I do now to make this waking period a little bit more pleasant, a little bit more restful, a little bit more comfortable for my body? And previously, I showed you this picture where being awake, not only is it uncomfortable, when you're distressed about it, you're suffering so much more. So I would invite you to consider, like, okay, if the wakefulness is there, how can I practice becoming less distressed about being awake in this moment? How can I make myself more comfortable? And when you are in this state, there is a higher likelihood for you to fall back asleep. And even if you don't fall back asleep, at least this period is a lot more restful than this. It's at least a little bit more restorative for your body. And so when it comes to sleep, I invite you to consider this question of, do I have control over our sleep? And my answer is going to be yes and no, because in the moment, you have no control over your sleep. Like if I have some kind of secret magic that will guarantee you to fall asleep right away, I'm going to be a billionaire. And that doesn't exist. So in the moment, we really don't have any control. But in the long term, we absolutely have some control. And the control lies in, we can set the stage for possible sleep in the long term by providing appropriate cues to our sleep system. So remember, we talked about these three systems. So you want high sleep drive, you want a strong circadian rhythm, and you want to be in a state of low arousal. And if these three things are in place, there's a higher probability of sleep. And when I say higher probability, it doesn't mean that you're going to get a great night of sleep every night. But what that means is, if you take a bird's eye view, you'll notice that you're now getting a little bit more better nights than not. And so that's what we can help with our sleep. And you can definitely still help increase the probability of sleep when you have chronic pain. So one quote that I really like is, pain is inevitable, suffering is optional. In the case of sleep, I would say that some wakefulness is inevitable, but suffering is optional. If you want to learn more about CBTI, there are a lot of self-management resources that you can consider. One is this Quiet Your Mind and Get to Sleep, Solutions to Insomnia for Those with Depression, Anxiety, or Chronic Pain. It's a good book. I would recommend this. Another one that I like is this one here. It's End the Insomnia Struggle, a step-by-step guide to help you get to sleep and stay asleep. In the middle here, these are two VA programs that are free. One is called the Path to Better Sleep. It's an online website-based program. And then there's Insomnia Coach, and that's a mobile app where it's a self-guided CBTI program. But sometimes you might need more than self-management resources. So you could consider seeing a CBTI specialist or a behavioral sleep medicine psychologist. And within Stanford, there's actually two behavioral sleep medicine programs. So one is embedded within the Stanford Sleep Medicine Center that's based in Redwood City, and this is the number to call. And then there's another sleep health and insomnia program, or Stanford SHIP, that's based in Department of Psychiatry in Palo Alto. Both have a wonderful sleep psychologist who would be able to offer CBTI. There is, a long wait list for these two. And so if you are really thinking about that, I want to do this, you can call to self-refer to be seen by a CBTI specialist. Finally, here are some additional resources put together by the pain psychology group. I'll highlight one group here, is the All About Sleep and Pain group. It's led by our wonderful sleep psychologist and pain psychologist. It's a great group to learn more about sleep and pain, along with the many, many other pain management resources. And finally, these are some of the references that I used today. So just listing it out. And I'm happy to take any questions.